Girls, come over here because I'm going to light this firework.
Girls. Uh-oh. Last chemo! Celebrate! Last chemo! So it's day 2 of my last chemo, and I'm so excited that it's my last chemo. But I did have a little problem this week. I noticed that the same breast as cancer started to ache a little bit more than normal. And the day before I had my last one, I noticed it was swollen and like was hurting and just looked different. So I had my doctor look at it before I had my chemo done, and they ordered an ultrasound and found out that they think it's cellulitis. The good thing was that they noticed that there was no sign of my tumor in that area, and that's kind of what I was afraid of. So that's the good news. So the bad news is that I have to be on an antibiotic for 10 days, 4 times a day. And it's a really strong one. So they said it would cause some belly discomfort. So today, the first antibiotic, I did notice my stomach was hurting, but I have to take it with food. So I've been trying to eat little snacks throughout the day when I take it. And I think that does help. I also am eating some yogurt for the probiotics, and my friend picked up today some probiotics for me. So that's going to help a little bit, but just kind of stinks that I have to do that during my last chemo, and I think it's going to be kind of a rough weekend if that's going to cause belly discomfort. And I already have belly discomfort from my chemo, and it usually starts on day 4. So I'm thinking that it's going to be not a fun weekend. But my mom's coming this weekend on Saturday, and my husband is on call, but hoping that he doesn't get too many calls. So anyway, today was actually pretty good. I felt, besides that a little belly ache this morning, I felt pretty good. And I had a friend come over and play with the girls outside. It snowed today, so they were excited, and I got a chance to rest this afternoon, which was really good. So I'm feeling pretty good now, so that's good. So you can't really see it because I took a shower, but these elves of my girls drew on my head and made all kinds of designs and wrote "Glitter and Ginger were here." So funny. Those silly elves. Today is day 9. I'm here at the hospital about to get an echo done. They've been doing echoes throughout my chemo, but they want to check my heart, make sure it's all set for surgery coming up in about 2.5 weeks. So not feeling really great today, but not terrible. My stomach is hurting a little bit, and on the way here I thought I should have taken a nausea pill, but I didn't. So I hopefully will be able to get through this with no problems. And they'll let me know how my heart is. So far it's been fine through this whole thing, so I think it's gonna be okay. But I'm just glad that they're keeping up on checking it out and making sure everything's good. Here come some members of my school again. Sound like they're having a good old time. So this is what my school brought down this time. They've been so supportive during this. Brought this awesome gift card tree, and also money from making from collecting money for jeans for November. So just amazing. I just can't thank them enough for all that they've done. Today is day 11, and yesterday I went to the cancer center to get fluids like I normally do after chemo. And I met with my doctor, and she checked out my cellulitis. She wasn't happy with the improvement of it. It has gotten a little bit better. It's not as achy, but it's still pretty red and swollen. And so what she wanted me to do was get a biopsy, so they could see if this is a different kind of infection, or and that would need to be on a different antibiotic, or if it has to do with the cancer. So I went and got a biopsy this morning, and he prescribed me to continue the antibiotic that I've been on for 10 days to do it for another 5 days. And I should get results from the biopsy in a few days. They did do a rush on it. Normally it comes back in about a week, so I'm hoping in a few days that I'll have those results. I've been in contact with my surgeon's office also, and they know what's happening, and they're telling me if the infection, or if it is an infection, isn't cleared up by the time I have surgery, that I will have to push back the surgery date. So I'm really hoping that we can clear this up, and I have 2 weeks and 2 days until surgery, so that's enough time, I think, to get this cleared up, hopefully. So anyway, the last couple of days have been okay. Yesterday I felt good, but today, not so much. And this morning I did feel okay, and then the stomach aches come on really fast, and I've had a stomach ache most of the afternoon. So that's been hard. I'm laying in bed, and yes, I'm wearing a winter hat in bed. Don't judge me. I have a bald head. And it gets cold. So this is like such a comfortable hat. I just wear it everywhere. So that's about it. Another pretty exciting thing is that my husband came home today, and his job has informed him that he needs to take this time with his family and help with my appointments, which he does, but just take time to just be together. And they've given him the rest of the 2020 off, the rest of this month, the rest of this year off, with pay. So I'm very, very grateful for them. It'll be nice to be together and try to create great memories before surgery, and to have him around to help me after surgery. So thank you for that, if you're watching. And that's about it for today. It's been an interesting couple of days. I did get the results back from my biopsy, and it showed cancer. And it's pretty far away from the original tumor. So my doctors are concerned that it spread while I was on chemo. This is not the news that I wanted. It's been a very emotional couple of days. I got a call from a doctor yesterday that suggested I have inflammatory breast cancer. We looked that up, and it's quite rare. Honestly, I don't want to Google anymore because it was too much information for me to read that I don't want to read. So I'm going to be just waiting for what the doctors say. I am in a hotel room right now, and had to stay overnight because we're going to a hospital that's quite far from my house. I have a not a biopsy. I haven't slept well. I have a CAT scan this morning. I have an MRI and a meeting with my surgeon. And they'll gather all that information and determine if I'm going to have to do more chemo before I have surgery, or if I'm going to continue with my surgery and do more chemo after. But I've been told no matter what, I have to do more chemo. So, one day at a time is all I can do. One moment at a time. I met with my surgeon, and the first thing she said was that the cancer has not traveled throughout my body. That was such a huge relief to hear. I was really, really worried about that, and I couldn't sleep, and it was just awful. So I'm relieved about that. She did say after looking at my biopsy and doing my exam that it does look like I have inflammatory breast cancer, which is quite rare. It accounts for 1% of all breast cancers. But I am happy that the hospital I'm going to, which is Dana-Farber in Boston, they do treat patients with inflammatory breast cancer. So that's hopeful to me. She did talk about how my next step would be that they need to retest my receptors to determine if it still is a HER2 positive cancer. She explained how sometimes the cancer cells do change during treatment. It's not common, she said, but it does happen. She said the other possibility is that they could be heterogeneous cells, and so that it did treat the HER2 positive part. But I think they'll definitely have more information when they retest the receptors. So they said they could use the information from my biopsy that I had about a week ago, or she thought that they could use that information. If not, that they would contact me to do a biopsy, another biopsy. So that's my next step. She did say that I would not be doing surgery as I was scheduled to do it, which would be in a little over a week, and that I would need to do more chemo first. And she explained, because, my husband and I were thinking, like, we just want it off. We want to get rid of this. But the way she explained it was that she wouldn't be able to get close enough margins, which means if she took the breast off, there would still be some cells left over in my skin, and that they would, the cancer would come back within a week or so. So she was very confident in this decision. She talked about how this is the critical time to make the right decision. And so we have determined that we are going to continue treatment at Dana-Farber because I think that they're going to help save my life. They have the very best research, the latest research, the clinical trials. And so I'm confident that I have a really good team that's going to help me. So I know that it's a long ride. It's a 3-hour drive just one way from where I live. Sorry, that's my dog. Harley, no. But I'm willing to do anything at this point. So I'll know a little bit more information in a few days about my receptors, and that will determine what kind of chemo I have to do next. So I will update you on that when I find that information out. I'm here early this morning doing my pickup order for my groceries. It's been a super long week. Excited to just stay home today after this. With traveling to Boston, and my youngest daughter had a dental procedure where she had to be put to sleep, but she's fine and it went great. And yesterday we bought a car. So we just wouldn't be able to make it the winter with our old cars, traveling to Boston back and forth. So we had to do it. We wanted something with lower miles and something where we could obviously afford, since I'm out on medical leave from my job. But I think we did it. We got a Ford Escape Titanium, and it's kind of nice driving this. And one thing I'm excited about is when they come with the groceries, I can pop the trunk. I don't have to get out. There was so many things that were going wrong with my other car. The back windshield wiper didn't work. Some of the lights didn't work. So I feel like I'm riding in luxury today. So anyway, I'm gonna go home and just clean my house and do lesson plans for my kids and just kind of relax today. It's been a long week, so I'm ready to just have a day of just staying home. So I went to Boston yesterday and I got my results from the biopsy that they tested here in my home state, and they were retesting my receptors. And so I'm gonna try to explain it the best that I can. I don't really fully understand it. But I did take some notes, and I really recommend that if you're going through this to take notes. I even actually now record my conversations with my doctors, because for one thing, my husband isn't allowed to come in anymore. So I'm on my own trying to hear this information. And it really has helped, because I've played it a few different times, and after hearing it 3 or 4 times, and I finally feel like I somewhat understand it. So I would definitely recommend that. So the results from the biopsy showed that my hormone receptors, progesterone and estrogen, are now positive, and my HER2 is negative. So back in July, when I first got them tested, it was showing that my hormone receptors were negative and my HER2 was positive, and that's why they said I had HER2 positive cancer. And so I went on a very strong chemotherapy regimen that should kill the HER2 positive cancer. My oncologist was talking about how it's unusual that both the hormone receptors and the HER2 have flipped the other way. And so he talked about how there's a couple of different explanations for this. The first one being that it could have just been that the results that they got in the first biopsy were wrong. Someone could have made a mistake somehow. He said that there's no reason for him to think that this was the reason, but I'm not so sure. The next possibility is, he talked about how breast cancer is not as uniform as we all think that it is, and parts of the tumor could be hormone receptor negative, parts could be hormone receptor positive, parts could be HER2 negative, parts could be HER2 positive. So the part that they biopsied showed HER2 positive. But he said that's not common, but it's not uncommon, that they have seen that before. So my oncologist and my surgeon are both kind of puzzled by this information that they got. And so what he recommended yesterday was to get another punch biopsy and another ultrasound guided breast biopsy. So I did have both of those done yesterday. The punch biopsy is more, from my understanding, more of the skin, and the ultrasound guided biopsy, it's guided because they are trying to find the tumor. And so that's getting deeper into the tissue, into the tumor. So today I am a little sore, but it's all worth it to me. I also had to get an x-ray to show that I have a port, because I will be starting chemotherapy next week, a couple days before Christmas. And he talked about how there's 2 different possibilities he's thinking about depending on what the results from the biopsies come back as. And they should be back early next week. So the first, if it comes back with the hormone receptors are positive and the HER2 is negative, then he's going to do an induction chemo called AC. Not really sure the names of those 2 drugs that start with A and C, but I will find out more information if that's the one that I get put on. The other one, if it shows that the hormone receptors are negative and the HER2 is positive, he's going to continue on with anti-HER2 positive chemotherapy called Cat-cycla. And so if I do the Cat-cycla, that's going to be every 3 weeks. If I do the AC, it's going to be every 2 weeks. And he also said that it would be every 2 to 3, or it's going to be 2 to 3 months of chemotherapy before I would have surgery. So the next step is to do this chemo for 2 to 3 months. And then after that, I would have surgery. I'd have my mastectomy. And then he said after that, I'd have radiation and then hormone manipulations, which I haven't even been talked to about yet because I have not gotten to that stage. So he did talk about how my last regimen, TCHP, was a very strong regimen, and they were a little surprised that it didn't work. So he talked about how it's either a really extremely severe cancer or it's not HER2 positive. And I just really hope and pray, and please, I know you guys have been praying for me, and just continue to pray that it's not HER2 positive, because if it is, then that means it's just an extremely severe cancer. And if the TCHP didn't touch it, I'm not sure that anything else will. I did ask about if it could be a chemo-resistant cancer. He said that it is possible, but he didn't really even want me to go there. So some of the things he said were really scary to me. And he talked about, the fact that the inflammatory breast cancer grew from having 6 strong cycles of chemotherapy is concerning. But he said it doesn't mean it's over. But using those words just makes me worried. So just please pray for me. I want to think, and I'm trying to think as positively as I can. So hopefully the results come back soon. And I'm actually, from my understanding, I'm really hoping that it's HER2 negative. It's continuing to be, because Harley, I'm feeling like if it's HER2 positive and the TCHP didn't work, that's not a good thing. But we can just keep hoping and praying that the next chemotherapy that I'm put on does work. And we can go from there. So thank you so much for your prayers, for thinking of me. I get messages daily. You guys have been amazing. And I just thank you for being my support for our family. And I will let you know in my next video how it's going with my next chemo, and what kind of chemotherapy they have put me on.